Callie has been the person who put this amazing panel together and got all these folks to travel here to Washington, D.C., and got them to write their statements. Callie will also be doing a wrap-up on this thing, but I thought right now, as we kind of move into the nitty-gritty of, what is actually happening within the industry, and I thought we'd have him speak at this point in time. So Callie Means is the co-founder of TrueMed, a company that enables tax-free spending on food and exercise. He recently started an advocacy coalition with leading health and wellness companies called End Chronic Disease. Early in his career, he was a consultant for food and pharma companies and is now exposing practices they use to weaponize our institutions of trust, and he's doing a great job doing interviews with his sister, Casey.
Thank you, Senator. When thinking and talking about healthcare early on, I would often make the lazy statement that, well, there's problems, but life expectancy has doubled. And I hear that. I hear that at meeting with, frankly, senators, members of Congress today. That's something we often go to. Well, our system's okay. As Peter Attia pointed out in his book, and this is so crucial, if you remove advancements from infectious and acute conditions, life expectancy has not increased in the past 100 years. We spend 90 to 95% of all medical spending on chronic issues, and it's done nothing. If you think about a medical miracle, it's almost certainly a solution that was invented before 1960 for an acute condition. Emergency surgical procedures to ensure a complicated childbirth wasn't a death sentence, sanitation procedures, antibiotics that ensured infection was an inconvenience, not deadly, eradicating polio, regular waste management procedures that helped control outbreaks like the bubonic plague, sewage systems that replaced the cesspools and open drains, preventing human waste from contaminating the water. The U.S. health system is a miracle in solving acute conditions that will kill us right away. But economically, acute conditions aren't great in our modern system because the patient is quickly cured and is no longer a customer. Starting in the 1960s, the medical system took the trust engendered by these acute innovations like antibiotics, which were credited with winning World War II. And they used that trust to ask patients not to question its authority on chronic diseases, which can last a lifetime and are more profitable. But the medicalization of chronic disease in the past 50 years has been an abject failure. Today, we're in a siloed system where there's a treatment for everything, and let's just look at the stats. As heart disease has gone up, heart disease has gone up as more statins are prescribed. Type 2 diabetes has gone up as more metformin is prescribed. ADHD has gone up as more Adderall is prescribed. Depression and suicide has gone up as more SSRIs are prescribed. Pain has gone up as more opioids are prescribed. Cancer has gone up as we've spent more on cancer. And now JP Morgan, literally at the conference in San Francisco recently, they put up a graph and they showed as more Ozempic is projected to be prescribed over the next 10 years, obesity rates are going to go up as more Ozempic is prescribed. Explain that to me. It was clapping. All the bankers were clapping like seals at this graphic. Our intervention-based system is by design. In the early 1900s, John D. Rockefeller, using that he could use byproducts from oil production to create pharmaceuticals, heavily funded medical schools throughout the United States to teach a curriculum based on the intervention-first model of Dr. William Stewart Halsted, the founding physician of Johns Hopkins, who created the residency-based model that viewed invasive surgical procedures and medication as the highest echelon of medicine. An employee of Rockefeller's was tasked to create the Flexner Report, which outlined a vision for medical education that prioritized interventions and stigmatized nutritional and holistic remedies. Congress affirmed the Flexner Report in 1910 to establish that any credentialed medical institution in the United States had to follow the Halsted-Rockefeller intervention-based model that silos disease and to downplay viewing the body as an interconnected system. It later came out that Dr. Halstead's cocaine and morphine addiction fueled his day-long surgical residencies, and most of the medical logic underlying the Flexner report was wrong, but that hasn't prevented the report and the Halstead-Rockefeller engine-based brand of medicine from being the foundational document that Congress uses to regulate medical education today. This is a game. We are getting sick. 9 out of 10 killers of Americans, 90% of medical costs are from a weaponized food system. It's not that complicated. When I say weaponized, I mean that literally. Our processed food industry was created by the cigarette industry. In the 1980s, after decades of inaction, the Surgeon General and the US government finally said that smoking might be harmful, and smoking rates plummeted. We listened to doctors in this country. We listened to medical leadership. And as smoking rates plummeted, cigarette companies with their big balance sheets strategically bought up food companies. And by 1990, the 2 largest food companies in the world were Philip Morris and R.J. Reynolds, 2 cigarette companies. These cigarette companies moved 2 departments over from the cigarette department to the food department. They moved the scientists. Cigarette companies were the highest payers of scientists, one of the biggest employers of scientists to make the cigarettes addictive. They moved these addiction specialists, world-leading addiction specialists, to the food department by the thousands. And those scientists weaponize our ultra-processed food. That is the problem with ultra-processed food. You have the best scientists in the world creating this food to be palatable and to be addictive. They then moved their lobbyists over. They used the same playbook. And their lobbyists co-opted the USDA and created the food pyramid. The food pyramid was a document created by the cigarette industry through complete corporate capture and was an ultra-processed food marketing document saying that we needed to eat a bunch of carbs and sugar. And we listened to medical experts in this country. The American people, American parents, many parents who had kids in the 90s thought it was a good thing to do to give their kids a bunch of ultra-processed food. And carb consumption went up 20% in the American diet in the next 10 years. The devil's bargain comes in that this ultra-processed food consumption has been one of the most profitable dynamics in American history for the healthcare industry, as we've all just been decimated with chronic conditions. The medical industry haven't not only been silent on this issue, they've actually been complicit, working for the food industry. I helped funnel money from Coca-Cola to the American Diabetes Association. The truth is we need to listen to the medical system if you have an acute issue like a life-threatening infection or broken bone, but when it comes to the chronic conditions that are plaguing our lives, we should distrust almost every institution regarding nutrition or chronic disease advice. As the panelists have described, we are at an existential moment, especially when it comes to the chronic conditions that make up 90% of medical costs. There's a slur about the American patient. Casey, one of her first days at Stanford Medical School, was told that the American patient wants to be sedentary, wants to eat ultra-processed food, that the best the medical system can do is stand with a scalpel and stand with a prescription pad and clean up the mess. Americans do not want to be sick. I don't believe it. It's the trillions of dollars of incentives that are in the way, and we must urgently remove corruption from the USDA, the CDC, the NIH, and our other medical institutions and get appropriate medical guidelines. We must renounce the Flexner report and prioritize root cause interventions and systems thinking to reverse the chronic disease crisis. Senator Johnson, thank you so much for convening this conversation.
Thank you, Callie. You probably didn't notice it, but there are an awful lot of heads shaking up and down as you were making your comments. And we'll come back to you to wrap things up. Next, we're going to go to Max. Max Lugavere?
Lugavere, yes.
Lugavere, okay, sorry. I'm generally bad about 500. That's about it.